Brought to you by Shannon Medical Center and Shannon Clinic.
The Pap smear has been a part of the Well Woman exam for over 60 years to help prevent cervical cancer. It's extremely effective in decreasing the death rate to cervical cancer, finding abnormalities on the cervix very early, and preventing cervical cancer.
But the new recommendations are you don't get a Pap smear until you're 21, and that's because we now know that cervical cancer is a sexually transmitted disease and it takes time for cancer to develop. Getting the virus that causes cervical cancer will cause changes on the cervix, and those changes have to progress over time. Most women will cure their own infection on the cervix, and then they don't have to worry about getting cervical cancer. So women under 21 don't need a Pap smear anymore. We also know that women after age 65 who've never had an abnormal Pap smear, they don't have the virus, and so they don't need a Pap smear either. Women after a hysterectomy, if they've never had a significant abnormality on their cervix, they don't need a Pap smear anymore. Women in their 20s, the new recommendations are that if they've had normal Pap smears, that they get a Pap smear every 2 years. And in your 30s, if all your Pap smears have been normal, you only need them every 3 years.
Pap smears today are more accurate than before. Additionally, there is a vaccine called Gardasil which prevents 75% of cervical cancers. It is important for young girls ages 10 to 25 to receive this vaccine. For more information on Pap smear screenings, please call Shannon Clinic OB-GYN Department at 481-2285.